Right now, in almost every city in this country, there are healthcare clinics with empty chairs behind the front desk. Not empty because nobody wants the job. Empty because nobody knows the job exists. And that gap is bigger than most people realize. This year, hiring managers across the country were asked which healthcare roles they simply cannot staff. And the answers were not what you'd expect. They weren't doctors. They weren't even nurses. They were jobs that most people drive past every single day without ever knowing they were an option. So here's why this matters to you specifically. Most of the roles I'm about to walk you through do not require a 4-year degree. Several don't require any prior healthcare background at all. What they require is something you probably already have: the ability to show up, pay attention, and treat people like people. That's not a small thing. That's the whole job, more often than not. In the next 20 minutes or so, I'm going to walk you through 8 healthcare jobs that employers are struggling to fill, what each one pays, what it actually takes to get in the door, how long the training runs, and what it costs, if it costs anything at all. Stay with me to the end because the last job on this list is the one with the fastest on-ramp of anything we cover today, and it opens a ladder that a lot of people don't realize exists. Let me set the stage first, because the scale of this is worth understanding before we get into the individual jobs. Healthcare is projected to add more new positions than any other sector in the American economy over the next several years, and multiple workforce studies point to a shortfall of several 100,000 frontline healthcare workers by the end of this decade. While other industries have spent the last few years announcing layoffs and hiring freezes, healthcare has kept posting openings it can't fill fast enough. And here's the part that matters if you've been worried about automation creeping into every corner of the job market: the roles that involve real hands-on contact with real patients. The roles that require someone to notice a shaking voice or a confused look and respond like a human being. Those are the roles that every serious labor analyst says are the safest from being replaced by software. A machine can schedule an appointment. A machine cannot comfort someone who just got bad news in a waiting room. One more thing before we dive in. The pay figures I'm going to give you throughout this video are drawn from national labor statistics and the organizations that administer these certifications. They're national averages, not guarantees. What you actually earn is going to depend on your state, the specific employer, and what you do once you're in the door. Treat these numbers as a floor to build from, not a ceiling. Job number 1 is the medical assistant, and there's a reason it's leading this list. When medical offices across the country were surveyed about their hardest role to staff, medical assistant came out on top, ahead of nursing, ahead of billing, ahead of nearly everything else on the org chart. This is the person who calls your name in the waiting room, takes your vitals, updates your chart, and keeps the entire clinic moving on schedule. Without them, a physician's whole day backs up. There are north of 800,000 medical assistants working in the U.S. right now, and the field needs well over 100,000 new ones every single year just to keep pace. The typical pay lands around $44,000 annually, with experienced assistants pushing toward $58,000, and those who specialize in fields like oncology or cardiology often earning more on top of that. Getting in usually means a training program that runs anywhere from 4 months to a year, followed by a certification exam that runs somewhere in the neighborhood of $150 to $170. And here's the part that should get your attention. A lot of hospital systems and clinics will pay for that training themselves, and many community college programs are subsidized through state workforce grants. If you've ever worked a front desk, managed a busy retail counter, or looked after a sick family member, you already carry most of the muscle memory this job requires. Job number 2 is the pharmacy technician, and this is one of the most overlooked doors into healthcare that exists. Turnover in pharmacy technician roles is so high in some chains that vacancy rates sit near 40% at any given time, which tells you everything about how badly these positions need to be filled. A pharmacy tech counts, labels, and prepares medications under a pharmacist's supervision, handles insurance questions at the counter, and keeps the whole pharmacy operation running on schedule. Typical pay sits around $43,000 a year, with hospital-based pharmacy techs often earning more than their retail counterparts, and experienced techs in specialty pharmacies clearing past $60,000. The certification exam, often called the CPHT, costs somewhere around $130. And here's the good news. Major retail pharmacy chains and hospital systems frequently train and certify their own staff at no cost to the employee. If you've ever worked a register, managed inventory, or handled any job that required careful counting and clear communication with customers, this is one of the easiest doors in healthcare to walk through. Job number 3 is the phlebotomist, and if speed is what you're after, this is the fastest legitimate entry point into the entire healthcare field. Training typically runs 4 to 8 weeks, and then you're working. A phlebotomist draws blood for lab testing, donation centers, and increasingly for in-home visits for patients who can't easily get to a clinic. And those mobile roles often pay more, with some markets pushing past $50,000 annually. The typical national pay sits around $42,000 to $45,000. Only a handful of states legally require a license, and most employers will hire and train you directly. The certification exam usually runs under $150. This job has become the on-ramp for a lot of people who eventually move into lab science or nursing, because it gets your foot in the clinical door fast, and it rewards people who are calm under pressure and good with nervous patients. Job number 4 is the dental assistant, and dentists themselves have been sounding the alarm on this one. National Dental Association surveys have repeatedly found that a large majority of dental practices consider staffing their single biggest operational headache, and dental assistant is consistently the hardest seat to fill. Typical pay runs around $47,000 a year, with experienced assistants earning past $60,000, especially in specialty practices like orthodontics or oral surgery. Here's what makes this one unusual. In many states, you don't need to complete an outside program before you're hired. Dental offices will bring you in, train you chairside, and often cover the cost of your certification once you're on staff. If you've ever worked in a hands-on service role, whether that's cosmetology, retail, or any job that required precision and patience with people up close, you already have the core skill set this role is built on. Now, let me pause here for a second because I want to talk directly to anyone watching this who's over 40 and has been quietly wondering if the job market has moved on without them. Maybe you gave a company 15 or 20 years and got shown the door anyway. Maybe you've sent out dozens of applications and heard nothing back. Maybe you've started to wonder if the problem is you. It isn't. The hiring system was built to take one look at your years of experience, decide you're expensive, and quietly move on to someone younger and cheaper to train. That's not a reflection of your value. That's a flaw in how the system filters people. If that's resonating with you, I put together a resource specifically for this situation. It walks through exactly what's happening behind the scenes when experienced workers get passed over, decodes what recruiters actually mean when they use phrases like overqualified, and lays out a 7-day plan you can start using tonight to change your approach. It's priced low right now for the first wave of people who grab it, and the link is in the description if you want it. Quick question while we're paused here. Of the 4 jobs we've covered so far, which one caught your attention? Medical assistant, pharmacy tech, phlebotomy, or dental assistant? Drop it in the comments. I read every one of them. And if this video is doing anything useful for you, most people watching this channel haven't hit subscribe yet, and subscribing is free, and it's the only way you'll catch the rest of what's coming in future breakdowns like this one. All right, let's get back into it, because job number 5 might be the best kept secret on this entire list. Job number 5 is the sterile processing technician, and I want to speak directly to a specific kind of person here. Someone who wants healthcare pay and healthcare stability, but has no interest in spending all day face-to-face with patients. A sterile processing tech is responsible for cleaning, inspecting, and packaging every surgical instrument used in an operating room. You won't interact with patients directly, but without this role functioning perfectly, surgeries simply don't happen. National nursing and surgical associations have flagged this as a genuine workforce shortage, citing a lack of training pipelines paired with high turnover among current staff. Typical pay runs around $45,000, with experienced techs in busy metro hospitals clearing past $60,000. Certification, often called the CRCST, involves an exam that costs under $150, and many online or community college programs can get you ready in roughly 3 to 4 months. Some hospital systems, including several major academic medical centers, will pay you a wage while you train. If your background includes manufacturing, laboratory work, military service, or any job that demanded strict adherence to procedure, this role fits like it was built for you. Job number 6 is the medical biller and coder, and for a certain type of person watching this, this is the one you've been waiting to hear about. This is the healthcare job you can do entirely from your kitchen table. A coder translates what happened during a patient visit into the standardized codes insurance companies use to process payment. It's detail-oriented, rule-driven work, and it is by far the most remote-friendly job on this entire list, with a large majority of certified coders working from home full-time. Typical pay sits around $50,000, with experienced coders clearing $65,000, and top earners in specialized fields pushing past $75,000, particularly those working directly for insurance carriers. The most recognized certification is the CPC, and the exam runs around $400. Self-paced study typically takes 4 to 6 months, making this the one job on the list that asks for real upfront homework, but it's also the one that lets you work in sweatpants. If you've ever handled billing, bookkeeping, or insurance claims in any prior job, your brain is already wired the way this role needs it to be. Job number 7 is the behavioral health technician. And this is the fastest growing role we're covering today, with projected growth rates running roughly 3 times the national average across all occupations. The country is in the middle of a documented mental health and addiction crisis, and treatment centers simply do not have enough hands to meet the demand. A behavioral health tech works directly with patients in residential treatment centers, outpatient clinics, and crisis facilities, providing day-to-day support, structure, and supervision. Typical pay runs around $42,000, with experienced techs approaching $58,000 to $60,000. In most states, you can start with nothing more than a high school diploma and on-the-job training, and a full certificate program typically runs anywhere from 1 semester to a year. If you've ever been a caregiver, worked in social services, or personally walked a family member through a mental health struggle, that lived experience is something no classroom can replicate. And it's exactly what employers in this field are looking for. And job number 8 is the one I told you to wait for, because on paper, it looks like the simplest job on this entire list, but it has more open positions nationally than any other role we've discussed today, with several 100,000 openings projected every single year. This is the home health aide and certified nursing assistant pathway, and I need to be straight with you the way I have been all video. The starting pay here is the lowest on this list, typically somewhere around $30,000 to $35,000 to start. So why is it saved for last, the anchor spot? Because this job isn't a destination, it's a launch pad. If you're over 45 and thinking you don't have time to start from the bottom of anything, listen closely, because the climb from home health aide to certified nursing assistant to licensed practical nurse moves faster than most people assume. And at nearly every rung, an employer is willing to foot the bill for your next certification. Here's how the ladder actually works. You start as a home health aide, and initial training can run as short as 1 to 6 weeks, frequently provided free by the employer. From there, you step up to certified nursing assistant, and your pay climbs. From there, the next rung is licensed practical nurse, and pay climbs again. Each step up typically adds somewhere between $5,000 and $15,000 to your annual pay, and at almost every stage, an employer will cover the training costs to get you there. If you're coming out of retail, hospitality, food service, or you've spent years as an unpaid caregiver for a parent, a spouse, or a child, you already carry the patience and the stamina this job demands. That's not a resume gap. That's the exact experience this industry is short on. So there they are. 8 healthcare jobs the industry cannot staff fast enough. And here's how I'd sum it up if you're trying to figure out where you fit. If speed is what matters most to you, phlebotomy gets you working in under 2 months. If you want to work entirely from home, medical coding and billing is your answer. If you want the strongest pay ceiling without a 4-year degree, sterile processing and pharmacy technician roles both punch above their weight. And if you want the absolute shortest distance between where you are right now and a paycheck in healthcare with a built-in ladder for growth, the home health aide pathway is unmatched. Every single job on this list shares 2 things in common. Employers are desperate to fill them, and none of them require the kind of 4-year degree the rest of the internet keeps telling you is mandatory. A lot of these programs are free. A lot of these employers will train you on their own dime. The opportunity here is wide open, and most people scrolling past it simply don't know it exists. If this video gave you something useful, do 2 things for me. First, subscribe, because most people watching right now haven't yet, and it costs nothing, and it's the only way you'll see the next breakdown like this one. Second, if you're over 40 and navigating this job search, the resource I mentioned earlier, walking through the hiring process specifically for experienced workers, is linked below. And it's the one piece of this video I wouldn't skip past. Keep climbing, and I'll see you in the next one.